Welcome to our newest episode, the Lebanese Physicians Podcast. And today we will be talking about a volunteer outreach clinic at the American University of Beirut Medical Center, which is the HEAL Clinic. It is a clinic that serves the migrant community in Lebanon and the LGBTQ community in the country. It is staffed by medical students and faculty at the American University of Beirut Medical Center. And today with us, we have three medical students who have been participants and active members of the HEAL Clinic. Alice Rishu, who is currently going into her Med 3 year. That's a big jump for her. And she did her BS in biology at AUB, and now she's third year medicine at the American University of Beirut. We have Marwan Ghanem, who has done his BS and master's in microbiology and immunology at McGill University, and now just started his fourth year medical school at the American University of Beirut. And we have Mark Kerzel, who again did his BS in biology and now just started his fourth year medical school at the American University of Beirut. And with us too, we've got Dr. Muhammad Ali Jardali, who is chief resident in the family medicine program at the American University of Beirut, and is supposed to be, I think, graduating in the next couple of weeks, tomorrow actually, and then he's going to be going into the real world afterwards. We'll see how he does. Welcome everyone to the podcast.
Thank you for having us.
Thank you for having us.
Of course. And since Muhammad Ali knows more about the HEAL Clinic than I do, I will let him start with the first questions on the clinic.
Okay, so I'll leave the floor to the medical students because they're the ones who are running the HEAL Clinic. If one of you can actually tell us what HEAL stands for and tell us more about the work that you guys do.
Okay, so I'm going to start in general about HEAL. So as you said, it's a student-run health initiative that aims to basically offer marginalized communities and minorities in Lebanon free high-quality healthcare services through our clinics at AUB. So the name HEAL itself is actually stands for our four pillars, which is health, empowerment, advocacy, and learning. First, the health part of HEAL is basically the clinics themselves that we have every Saturday. We also aim to empower the communities that we work with by educating them about health-related issues. And this is mostly through the work of the health ed team that Alice will talk about mostly. Then there's the advocacy, in which we advocate for those communities for providing good healthcare services for those communities in Lebanon, and that with the added benefit of actually providing AUB medical students with a meaningful experience in clinical volunteering and management. And this is where all our pillars come together in our clinics.
And how was the decision made to start this clinic? I'm sure somebody found a deficiency in the care of these patients and then decided to start it. So how was the decision made to start the clinic?
Okay, so here, it's the story of how HEAL started. So basically, it was a medical student at AUB called Lama Asi. She usually went to a migrant community center in Lebanon to help with English courses and other things, but not medically related in the community there. And they used to ask her a lot. They knew that she was a medical student, and they used to ask her a lot of questions that are medically related. And she used to see how the deficiency that was present in the care that was given to those patients. Most of them did not go to doctors in 10 years. It was very minimal. So this is when she decided to come back and start HEAL. She went through the process along with some of her friends, and the first clinic actually started in June 2017, and this is how it started.
Okay. Muhammad Ali, you can take the next question.
Definitely. So I think the work that Heal Clinic does is amazing, and I can attest to the part of it being really rewarding on a personal level. So maybe you can tell us more about the marginalized communities that Heal Clinic serves. I know you serve migrant workers, and just for our listeners to know, there's around 250,000, so a quarter of a million of migrant workers in Lebanon. So it's a huge community, and it's definitely underserved. So if maybe one of you can talk to us more about it.
So, okay. So, first of all, we all, I guess some of us know the dynamics between migrant workers and the Lebanese community here in Lebanon. And we know how these are people who basically don't have access to a lot of a lot of basic rights and a lot of the needs that human beings need to in order to survive, basically. So I guess through, how do I want to word this? Sorry. So basically, these are people who don't have access to primary health care in Lebanon. So we used to see some migrant workers come to the outpatient clinics in the hospital. But I think that those were the fortunate minority who were able to come with the people who they worked with, for example, or they worked for, who were nice enough to bring them to the outpatient clinics. Otherwise, a lot of our patients that show up, again, as Mark said, have never been to a doctor since they came to Lebanon, and they've been in Lebanon for maybe more than 15 years. So a lot of them will be suffering from, for example, hypertension or diabetes and not know that they have these problems. And this is basically the context in which we work. So we offer primary healthcare services. So our students my peers, not our students, will interview these patients and will see what their needs are. We order labs for them that are basically, we are partnered with a lab that's close to the university that covers they give us a discounted cost for the labs. And then in case we need to provide any treatment for the patients, we try to provide them with treatments that we already have, so with medications that we've already collected, or in case they need some surgery or something, we will try to fundraise in order to provide them with that as well. But yeah, these are people who are definitely really who completely fit the term marginalized community. So basically, a lot of them are not even allowed to leave their homes. A lot of them are not allowed to socialize with other people around them. And it's a very unfortunate situation. The other community that we serve is, again, the LGBTQ community. So this is more recent. We started working with Helem, which is a sort of so it's an NGO that works on the human rights of the LGBTQ community in Lebanon and in the region, actually, not just in Lebanon. And so we've been working with them. We started talking to them 2 years ago, and approximately a year ago, we started organizing the clinics for the LGBT community. And what's nice about this part of the clinic is that Helem is is funding all of the labs and the imaging that their beneficiaries need from us, but and so they come. So the patients come directly through them.
Okay.
And within the sorry, just one more thing. But within the LGBTQ community, what we focus on mostly is transgendered individuals, because they are, if you want, the most marginalized within the community that's already very marginalized in Lebanon. So a lot of people, most people in Lebanon don't even know that we have a transgendered community. And so this is because they're afraid to even go outside, because if they go out for a walk, they're at risk of getting beaten or getting put in jail for no reason. So that's why we also decided that to have clinics for them as well.
Yeah, I have two questions actually to follow this. One is, so the migrant workers, just for people to know, because not everybody knows, so the migrant workers in Lebanon, basically to this point, are basically they can be stuck in the house. Their employers can decide not to let them leave the house, and they don't have health insurance, right? They don't buy them health insurance as part of their work rights, right? And
migrant workers in Lebanon are organized under something called the kafala system. And the kafala system is really an oppressive system. Those migrant workers are actually excluded from the Lebanese labor laws. So they are an entity by itself. They don't have any regulation for their minimum wage, for their basic rights, for their health rights, even their passports. So it's a really outdated and oppressive system that borderlines on slavery, for lack of a better word.
Right. And there is a lot of NGOs in Lebanon now trying to push for an end to the kafala system. So far, I think with some success, right, but mostly unsuccessful at this point.
Definitely. And with the collapse of the financial and economic sector in Lebanon, a lot of those migrant workers are either leaving the country, but some of them don't have the proper and legal paperwork. So right now they're even pushed further into further marginalization, and they're losing what little rights they already had under the previous system. So they find themselves in a precarious situation that's even worse and worse.
Right. And then for the LGBTQ community, I know Helem has been pushing also for laws to legalize this. And there has been a couple of laws, right, that were pushed through, but still the community is marginalized at this point. Am I correct?
As far as I know, there's only been one or two legal cases of gender and sex reassignment that was approved by a judge. So those were like isolated incidents by the law, but the law itself wasn't changed. But the judges reinterpreted the law to provide legal venue for the trans community. But there's only been literally one or two cases, but it's definitely a step in the right direction.
Right, and because if you're part of the trans community at this point, you could be potentially arrested, right?
Yes, and that's the least of sorry, and I think that's just the tip of the iceberg to be arrested as a transgendered individual. So you could be, again, as I said before, you could be just beaten up for walking outside, sexually assaulted, verbally assaulted, and anything down the line. It's really horrible.
Got it. Okay, and so your clinic currently, the HEAL clinic, serves these marginalized communities, and now we know why they are marginalized. But it's not only medical care that you provide, you also provide health education, right? So Alice, can you tell us a bit about the health education that you provide for these communities?
Yes, of course. So basically, health education started from the idea that it wasn't just enough to diagnose patients, but it was just as valuable to educate them and empower them with that knowledge about their health and about health in general, so that they can also empower their communities with that acquired knowledge. So basically what happens usually, a main part of our work is during the clinics. So we see patients as health education during the time the patient is waiting to see the attending. And so we talk to them about their chief complaint, what they are here for. And if it's something that's not really worth talking about too much, maybe it's just pain in the leg, for example, and the attending will take care of it, we can tackle important topics like living a healthy lifestyle. If it's a woman, we discuss self-breast exam, why it's important to do it regularly. We give them awareness about that, and we notice the engagement on these topics. Basically, what we use also as health education is brochures that our volunteers have made throughout the years. The work has started in 2018, and since then we've been making many brochures on different topics. So we can hand them these brochures that are mainly in pictures. And so, for example, for a self-breast exam, they can have diagrams showing them what to do, and they can take them with them, keep it in their mind, and maybe tell their friends about it, which really helps because they usually live in communities also. So this is one important aspect of our job, and we don't just focus on physical health, but also on mental health. So recently we collaborated with the psychiatry department at AUB-MC, and we formed brochures on mental health topics like depression, anxiety, stress management, how to cope with trauma after the Beirut blast specifically. So we hand them these brochures and we discuss all these topics with them in the clinic. So the clinic becomes a safe space for them to talk. It doesn't just involve talking about their health and giving them a didactic lecture about why you should eat right. It mainly involves listening to them, understanding their concerns, seeing what they actually understand, what they need to know. And when it comes to anything related to mental health, we've noticed that most of the patients really see our room as health education as a safe space to talk, and it's been noticeable with both communities. So for example, to build on what we were saying about the migrant community, a lot of them come with a huge depression, and especially with these conditions because they can't go back to their countries. And so what happens is that they end up talking to us about how their employers used to abuse them with details. Sometimes they just want someone to talk to about these issues, and they're happy that we are listening. And they tell us how, for example, their employers from whom they fled stole their passport and their telephone, so they cannot contact their families and they cannot return back to their homes. And this is their main issue. You'd see a mother, she has one kid and she can't talk to him. She cannot even go back to see him. And it's really horrible. When it comes to the LGBTQ community, what really makes a difference, I feel, is how we give them the safe space to just exist without any discrimination, without the danger that comes from society, the Lebanese society as a whole. We use the proper pronouns, we have the proper training in all situations to properly address them. We've received training from Helem. We've done many trainings to just understand how to properly communicate with these patients. And a doctor from AUB-MC, Dr. Beatrice Khater, made a training video that all people who will attend the clinic will have to watch. Now, I will also just elaborate on another aspect of our work as health education, and then I can go back to this in further questions. But what we also do is we post the brochures online, and we also make videos that we post online, which started with the COVID era. We started by doing a live COVID session on how to take COVID precautions. And this is how our online work started when the HEAL clinic was halted. So we do videos and brochures and we post them online to share them with the MCC and the LGBTQ community of Helem. And lastly, the main other part of our work is the classes we give to the MCC community at their own center. And recently we've been giving particularly COVID vaccination sessions. So we educate them on COVID vaccines and we tackle any questions that they may have, any sort of weird thing they heard from the internet that they have concerns about. So that's mainly it, and I can go into the details further later.
I mean, this is great. All the work that you are doing at the HEAL clinic is just amazing. And I really want to stress on the primary care and on the prevention part that HEAL really focuses on, because this isn't just a clinic where you come for your common cold or for your blood pressure or depression. It's really primary care. It's really focused on prevention. So maybe this would be like a good segue for Marwan to talk to us more about like the how you expanded your services recently. And what was it specifically about the LGBTQ community and the trans community in particular? What was missing in the scene in Lebanon in terms of care for this marginalized community?
Okay, so I guess in Lebanon, there are a lot of sexual health clinics that offer basically your day-to-day STI screenings. There are HIV clinics. There are people specialized in multiple areas of sexual health, but these are the only places where the LGBTQ communities, where people who come from the LGBTQ community feel safe. So basically, most of the things that they have access to are sexual health, right? But we all know that this is just a very small part of health in general. So again, it's a lot like the migrant worker community. So a lot of the people that come to us haven't been to see a doctor in ages. So they come in, some of them are, older individuals who need screenings, who need, for example, a colonoscopy or whatever screening is age appropriate or whatever screening is appropriate for basically the person in front of us. Or other people will come in with, leg pain or just your day-to-day chief complaints. And then other people will come in with literally with not knowing what they have, but just feeling unhealthy. And then they turn out to have diabetes, they turn out to have hypertension, they turn out to have CAD, or, a lot of these things that are not apparent to the person who is not trained in the field. So this is what we focus on. So we focus on these things mostly. We try to screen as best as our capabilities. And we try to, basically, if a person turns out to have diabetes, we try to educate them in terms of how they have to change their lifestyle, or maybe change their lifestyle in order to prevent diabetes in order to prevent them from having diabetes, for example. And then what else? So we also, let me just regroup. Mark, do you want to jump in?
I don't have anything to add, actually. I think you covered most of it, if not all.
As well, we also so we try to provide as many medications as possible for our patients, but this is one major issue that we have right now is chronic medications. For example, again, we're talking about diabetes, hypertension, and to prevent the sort of complications that these might have later on. So we try to provide as much medication as possible to the patients, but at some point, we sort of reach a roadblock where we can't provide more. And this is a sort of issue that we're dealing with right now, is how to have access to medication that, as of recently, a lot of the medication that we used to have access to in Lebanon, we no longer have in Lebanon. And financially, we're sort of struggling with how to deal with these more long-term problems that the patients might be having. In the acute setting, if someone has leg pain, for example, we don't have a problem giving them the medication that they need acutely, to manage their leg pain, to manage whatever it is that they're suffering from acutely, or antibiotics, for example, or stuff like that. But on a chronic level, this is where we have roadblocks that we need to deal with. And this is what we're trying to figure out next.
We're also working actually on finding a way to refer patients to psychiatry when we see them in health education, or even the clinical volunteer or the attending sees them and they are presenting with depression or suicidal ideation. And it's a real challenge because to actually admit them to AUBMC, it's expensive, and we lack so far the funding to cover that. So we're working currently on finding a way to refer them to other psychologists that may be working for free, or organizations that have these psychologists. It's a work in progress.
And Alice and Mark, maybe can you give us examples of, like, specific examples of patients, maybe one a migrant worker, one an LGBTQ patient who came over and you helped? Without, of course, without mentioning any names, for sure.
There's actually one patient that I have in mind. So recently we did a Women's Health Day back in March, and it was dedicated for seeing multiple women, doing pap smears for them, etc. And also there was an entire floor where we had different stations that, as health education, we did them in collaboration with the OBGYN interest group in AUBMC. So they tackled topics like menstruation, safe sex, self-breast exam. And one of the patients in the self-breast exam room, she was educated on how to do it properly. And we later found out that she found a lump and she went to see a doctor, and now she's going to have a surgery very soon. And it's really gratifying how we actually managed to help her find this diagnosis and get the help she needs. So this is one example I have in mind. There are multiple examples of migrant workers or Helem patients that present and they have severe depression. I think there is only, for example, one person that comes to mind. He was an LGBTQ community member, and he was presenting with severe depression and suicidal ideation. And we managed to refer him to a psychologist with the help of one of our volunteers, actually, who did all the work. And it's quite gratifying to find that we managed to accompany this person during that day to properly assess how much he had depression, suicidal ideation, and to find out that he actually was seriously planning on ending his life, and to give him the care that he needed. And this shows how much what we do is actually valuable to the patients, and it's really amazing.
And how do you, one more question for you is, how do you guys advertise the clinic? So I bet now it's more like word of mouth that people come over, right? And hear about it.
Yes, of course, there is. Word of mouth is one of the ways, but we have Helem that actually refers patients to us when it comes to the LGBTQ community, and the work with Helem and Heal together. And then there's for the migrant workers, there was MCC in the beginning, and then there's the word of mouth, the flyers that used to be given, and so that's mostly it. Yeah, we also have a Facebook page and an Instagram account where we post everything. We post everything there basically.
We've been actually trying to expand our reach, which is why thank you so much for inviting us to sort of spread the word. It's very kind of you.
Yeah, you definitely have multiple pipelines for the different populations that you're serving, and they all roads lead to Heal Clinic, I guess. And I'm really glad to hear about the positive experiences you're able to make on a one-to-one basis and on a community basis. I know Marwan talked a little bit about the problems with finding medications, but maybe Mark can talk to us a little bit about how you've adjusted to the multiple crises affecting Lebanon. I know also Alice talked about transitioning more to the health education online. So we've kind of tackled this, but Mark, if you want to go into more details.
Yes, of course. So first of all, there are two crises we're facing, major crises, which is the economic crisis and the COVID, the pandemic. So when it comes to the pandemic, at first we had a small problem with the continuing the clinic. But then what we did is actually we did two things. We started telehealth for patients who we could follow up with, like not live, like just over the phone. And this actually helped us a lot. We actually were able to follow up with a lot of patients. And another thing we did was, after trying to reopen the clinic, we were able to do so by decreasing the number of patients in in one clinic. But at the same time, we used to space out the patients, like have a set number of patients come at 8:30 and other patients come at 10. So we used to space it out more until noon, actually. We just finish at 2:30. So this helped us a lot when it comes to COVID in decreasing the amount of patients in the clinic at the same time. Now, when it comes to the economic crisis, I think we're still having problems here because the funding is not, we used to do fundraisers live in front of, at AUB, in front of SML, our library. We used to go to the hospital for fundraising, for medications, to have drives, and so on. But this stopped for a while, and it was a problem to start again. And in addition to the crisis itself, which made it harder for people in Lebanon to donate. So all of this made the financial crisis maybe a bigger problem for us. But so I think that this is all I can say about those two crises. I can't think of anything else. I don't know if anyone has something to say.
Yeah, I'd just like to add one thing about the funding. So basically, for at least for the patients who are referred to us from Helem, so Helem has been able to cover them financially in terms of labs and in terms of imaging. And what we do is for all patients, Helem and the migrant workers, we have sort of been trying to find the least expensive imaging centers and the least expensive lab centers or labs to help us with our costs. So basically a lot of, a specific lab in mind, MAP Lab, which is right next to the university, has been able to give us any kind of study or a lot of different types of studies that we might need for a fraction of the cost, which has really helped. Yeah.
So to make up for some of the lost funding, I guess, how can people from outside Lebanon help with this?
Who would like to answer this question? Okay, so I'll give it a shot. So I think as of now, I mean, ideally, we would like to ask people, if they can, of course, to donate any small amount of money that they would be willing to help us with, because we all know, or basically some of us at least know, the cost of the Lebanese pound. So if you donate $1, it would actually help a lot in terms of the Lebanese currency. However, right now, we do not have that option open as of yet, because we're still working on opening a bank account where we can accommodate the funds that are coming in. Because as you know, we also have a banking crisis in Lebanon. So this has been a challenge. Other things that come to mind is if people anywhere, I mean, in Lebanon or outside of Lebanon, if anyone has spare medications that they no longer use or that are not expired, obviously, that they can just let go of. We always open our doors to any donations that people might be willing to give us. Of course, anything that hasn't been compromised or, and otherwise, just spreading the word about the clinic is also a very helpful means, because at some point we're gonna want to start asking people if they would like to donate. But as I said, where we have a roadblock there.
Right, and the other issue is, I guess, can you bring in spare medications? Probably you can bring small numbers, but you cannot bring big numbers because you would probably be stopped at the port of entry, right?
Yeah, that is true. I mean, unfortunately. Now, I know that during, for example, the aftermath of the explosion that happened in Beirut last year, there are a lot of people who actually started doing these drives elsewhere, so in France and the UK and Canada, and they would bring the medication with them. I'm not sure how legally that works right now because we're in a much quote unquote more stable situation. Yeah, I'm not sure. We're open to suggestions actually. If any of our listeners are would like to suggest ways that they can help, because we're still in the works. Actually, we are not 100% in work.
Regarding the drives, if I'm not mistaken, you can get a permit from the MOPH, the Ministry of Public Health, and they won't give you an issue at the airport. So it can be arranged.
So that would be something that we'll be working on soon. Thank you.
Okay, so this, guys, this is like amazing work that you're doing. I'm so happy to hear about all the initiatives you're taking. And I guess I'd want to ask you about like what kind of support you've been having and how important has mentorship been to you at Heal Clinic?
Mentorship at our clinic actually is something that's very important. It's one of our pillars is learning. So when it comes to mentorship, I think Marwan once told me there's several levels or different types, if you want, of mentorship that we actually work on. So first of all, there's the mentorship when it comes to the awareness on how to deal with and how to address the people that are coming to our clinic, specifically the LGBTQ community. And this is something very important, I think, to make them feel safe, to make them feel more welcome, and so that it's much, they feel better when they're safer when they're here. Another thing when it comes to mentorship is the mentorship from the attending to the clinical students that happens after every encounter. After the student sees the patient, you have the attending that basically goes through the case with the student, then gives the final verdict if you want, and sees the patient if need be. So this is very important, I think. And another type of mentorship is between the clinical volunteer and the preclinical volunteer that's with him in the clinic. So the Med 3 or 4 student always has a Med 1 or Med 2 student shadowing them and learning about the experience, about the case itself. So I think this is those three are the major points I wanted to talk about.
Excellent. And any closing remarks from you, from anyone?
We would just, again, like to reiterate how thankful we are that you invited us for today. We would also just like to give a shout out to all of the residents and attendings who have been kind enough to join our clinic and to come and help out for, free of charge and just out of the goodness of their hearts. So that's always amazing to see. And we just, thank you. That's it. Yeah,
thank you everyone for being with us today. I think it was a good episode discussing the Heal Clinic, the communities it serves right now, which are very important communities, I think, and are very marginalized communities at this point. And I think they are not. It's not only in Lebanon, but I think in a lot of other countries, these communities are marginalized, and I think there has to be laws that should be coming up to change the situation of these people, because they also have the same rights as any other person. And I hope this will happen soon in Lebanon at this point. So thanks to you all for all the work that you do. And hopefully we will ask our listeners to give us ideas on fundraising for the clinic and how to help out with that.
I think it's just great to have the advocacy part of it. I think it's very uplifting to have medical students run a free clinic, and the intersectionality of human rights and advocacy is just something to think about, just leaving this episode, just thinking about how all of this intersects and how we're building a grassroots movement through small acts of kindness and small acts of volunteering on Saturdays. I think like this is building a movement for the future generation of doctors in Lebanon. It's very heartwarming.
Yep, I agree 100%. Thank you very much.
Thank
Thank
you
you so much.
So much.